Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. This week, we will again be discussing major developments and events over the past 7 days in the Middle East region across healthcare, public health, life sciences, and wellness. As always, you will hear trends, insights, and the latest developments across the Middle East region for the week leading up to September 25, 2025. Our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets through our internal data and analytics platform, HealthConnect Middle East. First up is healthcare policy and government initiatives. Saudi Arabia and Syria launch health cooperation. The Saudi Ministry of Health announced on September 21 a new digital link between its Seha Virtual Hospital and the Syrian Ministry of Health, under a signed Memorandum of Understanding. This unprecedented partnership lets Syrian clinicians access Saudi specialty expertise for remote consultations, diagnostics, and treatment support. Through the platform, Syrian medical staff will collaborate with Saudi hospitals and specialists around the clock, expediting care in emergency and specialty cases. The MAU covers joint training, e-health systems, preventive medicine, and other fields, reflecting a Saudi commitment to bolster regional healthcare capabilities and system interoperability. Riyadh framed the step as part of its Vision 2030-driven health diplomacy, aimed at strengthening allied health systems via digital transformation. In practice, the link means a Syrian patient at a far-flung clinic can be evaluated virtually by a Saudi neurologist or radiologist with needed expertise, improving outcomes amid Syria's recovery. This government-led cooperation on health infrastructure underscores how Middle Eastern nations are pooling resources and technology at the policy level. Oman advances e-health data integration. Oman's Ministry of Health began a nationwide patient data update drive on September 23 to support its new integrated health insurance framework. Under this initiative, every citizen and resident visiting a public clinic or hospital must verify and update their personal and contact information for inclusion in a national electronic health record system. Health officials said the program will feed into Oman's long-planned digital transformation, ensuring the country's next-generation health platform, including an upcoming unified EMR for insurers, has accurate citizen data from day one. Practically, each clinic and hospital is now asking patients to reconfirm addresses and IDs, standardizing data for instant access to medical history. This is part of a broader government push aligned with Oman's healthcare digitization strategy to integrate primary care, hospitals, and insurers on a single digital backbone. By building a complete electronic dossier on every patient, Oman aims to facilitate its national health insurance rollout and better manage population health through data-driven care delivery. Jordan unveils quality and safety strategy. The Jordanian Ministry of Health launched on September 18 its long-awaited National Policy and Strategy for Quality and Patient Safety, 2024 to 2030. Developed with WHO and EU technical support, the strategy reflects a national commitment to reduce medical errors and elevate care standards. Health Minister Ibrahim Bidur described it as a milestone in modernization that places citizens' health at the center of all reforms. The strategy, approved by the Cabinet earlier this year, calls for reinforcing governance, accountability, and data integration across the system. Its priorities include strengthening adverse event reporting and aligning services with international quality benchmarks. Importantly, the plan emphasizes patient-centered care and transparency, envisioning stronger community engagement in shaping health services. In short, Jordan's government is formalizing a cross-sector effort, involving public, private, and NGO stakeholders, to transform hospitals and clinics into safer, higher-quality care providers. This initiative highlights how Middle Eastern governments are now codifying health sector performance and patient safety standards as core policy, a necessary step toward universal coverage and trust in public health services. Other national policy moves. Across the Gulf, health ministries continued rolling out reforms. For example, officials in Riyadh reported on September 16 that new targets on service access and treatment times have already yielded measurable improvement in Saudi hospitals, 90+% of ER patients seen in 4 hours. Kuwait's health ministry, in parallel, has been working on expanded vaccination mandates for school children, a measure announced September 7, and is preparing a plan to digitize immunization records nationwide. In the UAE, the Ministry of Health and Prevention, MOHAP, has announced the development of a national framework for healthy aging, see wellness section below, and is integrating private clinics into electronic referral networks. Meanwhile, Bahrain's government has continued coordinating with its GCC neighbors on health regulation. The kingdom hosted a meeting of the Gulf Health Council's executive board on September 17 and is finalizing its long-planned Hakim insurance program for 2026. Overall, this week's policy updates show governments in the region using legislation, national plans, and international agreements to drive health system change, whether through insurance mandates, digital transformation, or quality standards that underpin better delivery of care. Next, we have life sciences and research innovation. Innovative research and cross-border R&D partnerships are also in focus. A notable development was the report launched at Abu Dhabi's Brain Conference, September 21 to 24, by The Economist Impact and Eli Lilly. Titled, Changing the Narrative, Alzheimer's Disease in the UAE, the report highlights the UAE's progress in dementia care and maps out next steps. It praises the UAE's proactive measures, from awareness campaigns by MOHAP and charities to Sharjah's WHO-recognized age-friendly city initiatives, but urges a dedicated national Alzheimer's plan and more screening in primary care. The takeaway is that UAE leaders see neuroscience R&D as a national priority. The report concludes that leveraging 35 years of Eli Lilly's Alzheimer's research through stronger policy and partnerships can transform care locally and shape global practice. In practical terms, this could accelerate clinical trials and early diagnostic programs in the UAE. The emphasis on collaboration between industry, government, and academia in tackling an aging-related challenge exemplifies how Middle Eastern countries are fostering life science ecosystems and research roadmaps. Another research-driven initiative is Saudi Arabia's launching of BIO Middle East, announced September 23. Set for May 2026, this conference and expo, co-located with the CPHI Pharma Show in Riyadh, will bring global biotech leaders to discuss innovation and partnerships. The Saudi health minister hailed it as a significant milestone in positioning the kingdom as a hub of biotech and life science innovation. Indeed, the event will showcase cutting-edge biotech research and startups from around the world, aligning with Saudi Vision 2030 goals to diversify the economy via high-tech health industries. This commitment to hosting an international bioscience platform underscores a broader Gulf trend, directing large-scale funding and infrastructure into genomics, drug discovery, and medtech R&D. Early bird registration has already begun, and leading universities and research institutes across the region are preparing to participate. Regionally, university and biotech institutes are also active. For instance, Cairo University researchers unveiled a new AI-driven diagnostic tool for early diabetes risk prediction, trial results published September 20. In the Gulf, Qatar's Hamad Medical Corporation reported on September 22 that its stem cell research center is expanding studies on regenerative therapies for cardiovascular disease. And in the Levant, Jordanian clinical teams announced plans to collaborate with WHO on a regional strategy for cancer research, leveraging their new national quality strategy's emphasis on data integration. Taken together, these and similar developments, from particle accelerator facilities to genomic biobanks, indicate that Middle Eastern life science innovation is accelerating. Academic consortia and private research funds are actively targeting major health challenges in the region, creating a pipeline of future breakthroughs in diagnostics, therapeutics, and preventive medicine. Now let's discuss biotech and pharmaceutical developments. In biotech and pharma, this week saw continued emphasis on local manufacturing capacity and industry growth. A key headline is Saudi Arabia's strategic focus on biotechnology innovation through the new BIO Middle East Conference, see Life Sciences above. Government sources explicitly link this initiative to accelerating biotech investment and local drug development. Health officials note that Saudi Arabia aims to become a global hub for biopharma, and they are using events like this to attract partnerships that will boost domestic production of novel therapies. Pharmaceutical industry news also features cross-border deals. For example, an Egyptian drug regulator announced in mid-September that it will facilitate partnerships for regional vaccine production, building on last year's move to grant WHO Maturity Level 3 accreditation for vaccine regulation. Although that accreditation news came in late 2024, its impact is now being felt. Egyptian authorities are negotiating supply agreements to make the country a hub for vaccines and medicines for North Africa and the Arab world, promising new investment and knowledge transfer. In the Gulf, biopharma startups are getting attention. Riyadh's Startup Accelerator program opened its 2025 intake for health tech entrepreneurs this week, looking for candidates to commercialize innovations in medical devices and biologics. Likewise, in the UAE, venture arms of major hospitals announced they were investing in local biotech firms. One UAE hospital group disclosed a multi-million-dollar fund for homegrown drug developers. These moves align with a larger shift. Governments are linking health sector strategy to national industrial strategy. The combined message is clear: building capacity to research, develop and produce medicines and therapies locally is now a major priority across the region. Meanwhile, on the regulatory front, Middle Eastern drug agencies continue to expedite innovative therapies. Saudi Arabia's FDA, SFDA, announced on September 20 that it has issued import waivers for an experimental gene therapy for a rare metabolic disease, making it one of the first approvals of such a therapy in the Arab world. And Oman's health ministry revealed plans to streamline approvals for biological products. Such measures aim to attract global pharmaceutical companies to test and register breakthrough treatments in Gulf markets sooner. In sum, the Middle East's biotech and pharma sectors are in growth mode. National strategies and new conferences are spurring demand for innovative products and encouraging collaboration in R&D, manufacturing, and investment. Now the always important topic of public health challenges and disease outbreaks. This week's news continued to highlight serious public health crises, especially in conflict and crisis zones. In Gaza, the humanitarian situation is increasingly dire. The WHO reported on September 10 that starvation and malnutrition are now widespread across Gaza, reaching historic levels. As of early September, over 500,000 people there were living in catastrophic hunger, IPC Phase 5 famine, and WHO noted that 361 Palestinians have already died of malnutrition, including 130 children, in recent months. Medical infrastructure in Gaza is collapsing. The WHO emergency update described 94% of Gaza hospitals as damaged or destroyed, with the survivors overwhelmed by mass casualties. Indeed, United Nations and NGO reports from September 22 to 24 indicated that Gaza's main hospitals have been repeatedly bombarded or blockaded. One report noted that Gazan emergency wards are overrun, and patients and staff are fleeing as Israeli forces advance. For example, Gaza's specialized children's hospital, Al-Rantisi, was forced to evacuate on September 22 after an attack severed its power and water systems. A recent Washington Post dispatch described at least 28 clinics and treatment centers in Gaza City going out of service in late September. In short, Gazans are now facing a public health catastrophe of starvation, infectious disease risk, and no functioning hospital care, an unprecedented humanitarian and health emergency in the region. International agencies are calling for urgent aid corridors and ceasefires, but for now patients with chronic illness and war injuries are dying for lack of care and basic supplies. Elsewhere in the region, infectious disease threats are emerging. Medicines Sans Frontiers reported on September 23 a 65% spike in acute watery diarrhea cases within 1 week in Yemen's coastal provinces of Hodeidah and Hajjah. MSF teams attribute this dramatic rise to collapsing water and sanitation services amid prolonged conflict and funding cuts. While not every case is confirmed cholera, such outbreaks of diarrheal disease are often precursors to cholera epidemics. Yemen has already been battling a massive cholera crisis for years, and now a new surge in AWD cases threatens a new epidemic wave. Public health experts warn that without a scaled-up emergency response, including clean water, ORS treatment, and vaccines, this outbreak could claim many lives, especially among children. In the Gulf and Levant, we're not seeing new large-scale outbreaks, but public health authorities are vigilant. Saudi Arabia reported an uptick in a few MERS-CoV cases this year, though none were announced in the past week. Countries continue seasonal influenza surveillance, which will become critical soon. Qatar and Bahrain have intensified influenza vaccination drives to prevent a seasonal outbreak. Meanwhile, Jordan and Lebanon are monitoring a rise in dengue fever cases linked to the rainy season, though numbers remain low so far. In summary, the dominant regional public health threats right now are not novel viruses but the catastrophic consequences of conflict, malnutrition, refugees, waterborne disease, in Palestine and Yemen. These crises, exacerbated by healthcare disruptions, drawing major humanitarian response, even as other Middle Eastern health systems maintain routine disease control measures. Now we turn to wellness and health promotion. Alongside crisis response, Middle Eastern governments continue to promote preventive health and wellness for the general population. In the UAE, the Ministry of Health and Prevention, MOHAP, kicked off a major healthy aging campaign on September 25. Under the theme, Your Presence in Life is Health and Happiness, MOHAP began a month-long awareness drive and unveiled its national framework for healthy aging, 2025 to 2031. This initiative, which includes the appointment of healthy aging ambassadors, aims to emphasize preventive care for seniors. It highlights the UAE's growing focus on non-communicable diseases and quality of life. MOHAP officials noted that improving lifestyle factors and screening for conditions like dementia are key aims. They also plan new community programs, e.g. exercise and memory workshops, to keep older residents active and socially engaged. The campaign reflects how Gulf states are increasingly prioritizing wellness culture as a complement to clinical care. In Egypt, the national 100 Days of Health campaign, started July 15, has involved massive health promotion. By early September it had delivered over 71 million free medical services in outreach clinics. Equally noteworthy, the campaign incorporated an extensive public education component. Over 79,000 Egyptians received health awareness sessions from outreach teams in public spaces, shopping malls, clubs, etc. These talks covered preventive practices, like hygiene and diet, and guided people to appropriate services. Importantly, Egypt's health ministry included mental health in this outreach. Its Your Health is Happiness initiative embedded psychosocial support into campaign services, offering counseling and stress management tips to the public. Officials say the campaign's blend of free screenings and awareness efforts is raising health literacy nationwide. In other wellness news, Qatar's health authorities launched a seasonal influenza vaccination campaign on September 17. Additionally, across the region non-governmental efforts have stepped up. For example, Saudi NGOs are organizing free weekend fitness classes for women, running events in Jeddah on September 20, and a UAE charity held its first mental wellness fair in Dubai on September 21 with workshops on stress relief. World Patient Safety Day, September 17, was observed in Bahrain, with government messages on safe medication use. Overall, governments are keeping preventive health on the agenda. They're leveraging school programs, public events, and media campaigns to promote exercise, healthy nutrition, vaccination, and mental health awareness. In the Gulf, wellness is increasingly seen as a cultural priority, with ministries and health promoters trying to shift the population toward healthier behaviors to complement clinical reforms. Always exciting is digital health innovation next to discuss. Digital health continued to expand. Most notably, Saudi Arabia's new virtual hospital linkage with Syria, reported above, is a major telemedicine milestone for the region. Meanwhile, Oman's rollout of its national electronic health record relies on internet infrastructure improvements nationwide. Another digital development, Egypt's health authority announced on September 14 a national telemedicine platform connecting Egyptian doctors abroad with patients at home. This allows Egyptian specialists in the diaspora to consult remotely with patients under the country's new universal healthcare insurance scheme. Although details came after our cutoff, this initiative reflects how even populous countries like Egypt are using digital tools to increase specialist coverage. Region-wide, September saw big health tech conferences that underscored digital priorities. For example, Dubai World Trade Center hosted a major digital health expo from September 8 to 10, where more than 300 startups and 5,000 professionals showcased AI diagnostics, wearable monitors, and interoperability solutions. Saudi health IT firms announced partnerships with US and European companies at Riyadh's Arab Health Week, focusing on AI for imaging and blockchain for records. On policy, The Gulf Cooperation Council is finalizing a regional strategy on telehealth standards, and Oman's telecom regulator this week approved expanded e-health data transfer rules. The examples of KFSHRC's Smart Neuroscience Ward and the Saudi-Syria telemedicine link illustrate a broader trend. The Gulf is building the infrastructure for a digital health transformation. Many hospitals in the region are investing in 5G networks, AI triage bots, and integrated patient portals. Public-private collaborations are underway. For instance, Qatar's PHCC announced a partnership with a Silicon Valley firm to deploy AI symptom checkers in primary care. In sum, the digital health field in the Middle East is moving quickly. Governments are launching national e-health projects, hospitals are piloting tech-driven models, and startups are aggressively pitching solutions. This week's Saudi-Syria link and Oman's data mandate are part of a wave of projects leveraging connectivity and data to make healthcare more responsive and accessible across borders. Hospitals. News on hospitals this week fell into two contrasting stories: crisis and innovation. In Gaza, the conflict is decimating hospital infrastructure. Gaza City hospitals are closing under fire. In late September, the only children's hospital, Al-Rantisi, was forced to evacuate after an Israeli strike cut off its water and power. A UNOCHA report cited this and noted that dozens of primary clinics and specialist centers in Gaza City and southern Gaza had also suspended operations amid the offensive. Jordan's military-run field hospital in Gaza City was similarly evacuated on September 23 after nearby bombardments damaged its structure. In short, every functioning hospital in northern Gaza is now overwhelmed, damaged, or fleeing staff. This has left hundreds of thousands of Gazans without any hospital care. UN agencies warn that, if the expected ground offensive in Gaza City proceeds, the enclave could lose more than half its remaining hospital beds. These developments, closing wards, broken supply lines, and mass patient displacement, mark a collapse of Gaza's hospital network in the face of war. In a starkly different development, Saudi Arabia inaugurated a smart neuroscience ward at Riyadh's King Faisal Specialist Hospital on September 8. This new ward combines advanced technology with patient-centered design. Each private room has high-precision EEG sensors and AI-based seizure detection to alert physicians even before convulsions occur. It even features built-in electromagnetic shielding to eliminate digital interference, ensuring crystal-clear neurological monitoring. The idea is to support complex care such as epilepsy monitoring and brain surgery recovery with cutting-edge IT. The ward is also networked via secure telemedicine links to the hospital's Medina branch, allowing Saudi neurologists to collaborate across cities in real time. According to hospital officials, this is the Middle East's first facility of its kind, an example of how leading Gulf hospitals are adopting smart hospital technologies to provide top-level care. Other hospital news in the region includes expansion projects and management changes. For example, Bahrain's largest government hospital group announced plans on September 21 to add 2 new surgical wings by 2026 to meet rising demand. Egypt's health ministry said construction is underway on 3 new governorate hospitals under its 2025 to 2030 infrastructure plan. The UAE continues to upgrade its public hospitals. It has deployed a new national electronic referral system linking over 100 hospitals to optimize capacity. And Israel's Ministry of Health reported on September 24 that it will increase hospital bed funding for hospitals treating Gaza casualties that receive wounded patients through its medical aid program in southern Israel. Israel's domestic announcements are sometimes reported alongside these regional updates, given their impact on service delivery across the Levant. Overall, while war and instability are shuttering hospitals in Gaza, the rest of the Middle East is incrementally building capacity, opening new wards, expanding specialty units, and integrating smart systems to improve hospital care for their populations. Finally, we turn to population health management. Our final topic is population health management, how countries are organizing prevention, insurance, and data for whole population well-being. A top story this week was Qatar's launch, September 17, of its national influenza vaccination and awareness campaign. The health ministry emphasized vaccinating high-risk groups, chronic disease patients, seniors, young children, and pregnant women, ahead of the winter flu season. Free vaccines are being provided at clinics and workplaces for qualifying people, under the Universal Healthcare Insurance Framework. Officials stressed that annual flu shots are crucial to safeguard public health, especially as seasonal infections rise in cooler months. This proactive campaign illustrates a population health approach, immunizing vulnerable cohorts en masse to prevent outbreaks and reduce the burden on hospitals. Oman's patient data update program, discussed earlier, also ties directly to population health management. By ensuring up-to-date records, Oman is enabling nationwide risk stratification and targeted outreach. Health planners will be able to use the consolidated data to identify patients due for screenings or those with uncontrolled diabetes, for example. Combined with Oman's new insurance rollout, this data step is part of a larger shift to value-based care. Insurers and providers will soon coordinate on population health metrics. Elsewhere, Bahrain and Saudi Arabia are advancing policies to manage population health. Bahrain's health ministry is piloting workplace wellness regulations, requiring large companies to promote annual health checkups and fitness breaks for employees. Saudi Arabia reported this week that its national health statistics platform will soon include obesity and smoking rates by region, enabling officials to tailor prevention campaigns. Jordan is broadening a national screening program for non-communicable diseases. Next year it will mandate blood pressure and glucose tests at primary care visits for all citizens over 40. These examples reflect a growing emphasis on prevention programs, universal screening, and insurance coverage as means to keep populations healthier and avoid future costs. It's also worth noting regional data initiatives. Both the Gulf and Levant are investing in health information exchanges. The UAE's Abrahamic Multinational Hospital Network announced it will launch a region-wide disease registry, cancer and heart disease tracking across member states. The WHO's Eastern Mediterranean office is helping build health data platforms in war-torn areas. In sum, population health management in the Middle East is advancing on multiple fronts: more vaccinations campaigns, expanded insurance coverage, and data-driven prevention. Together these efforts aim to shift the focus from episodic treatment to keeping communities well at scale. Let's summarize this week's review. This week's overview shows a Middle Eastern health landscape of contrasts, ambitious innovation and expansion in many countries, alongside humanitarian crises in others. On one hand, governments and health systems are pushing forward bold new initiatives. Saudi Arabia's Vision 2030 continues to translate into action, exemplified by digital health partnerships with Syria and the launch of biotech conferences to seed tomorrow's drug breakthroughs. The UAE and Qatar are mobilizing campaigns on aging and immunization that will promote healthier lifestyles. Jordan and Oman are upgrading health governance and data platforms to drive better quality of care. Across the region, hospitals are adopting smart technologies and increasing capacity, while regulators streamline access to cutting-edge treatments. These moves reinforce a shared vision, positioning the Middle East as a hub of medical innovation and integrated care. On the other hand, deep challenges remain. The war in Gaza and the conflict in Yemen have created public health catastrophes that no country can solve alone. Hospitals there are overwhelmed or destroyed, civilians face famine and epidemics, and massive humanitarian aid is urgently needed. These crises are the stark reminder that health is inseparable from peace and security. As we have reported, humanitarian organizations warn of rising deaths from starvation and disease. The suffering in these regions will surely influence regional health policy, for example, underlining the importance of emergency preparedness, cross-border cooperation, and global support. For healthcare leaders and listeners of HealthConnect Middle East, the week's events underscore that progress in our region is uneven but advancing. If Vision 2030 and allied strategies are to succeed, they must be paired with solidarity on core public health issues. Encouragingly, we see that even crisis-stricken countries like Syria are entering health partnerships, and all nations are rallying support for conflict-affected populations. This reflects a deepening regional health diplomacy. We will continue to monitor how these narratives develop. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.